still is connecting. Tell me please. बोलो अपने दिल में क्या है बोलो ना. अरे वो तो है, वो नेगेटिव सेंटेंस मत बोलो. इतने साल में मैं एक्सपर्ट हो जाती हूँ, ये आप बोलो. Good. Likewise, you just tell me. 5 years, 2 years. Huh? Then tell me, Dr. Purnima, from your side.
So every patient will be different. So with your practice, you keep learning more and more.
No, you should tell at least. So I will become expert in these years. Huh? 5 years. How about Dr. Akshata?
3 years.
Wow, good. Right. आप लोग? ಹೇಳಿ ವಿಜಯಲಕ್ಷ್ಮಿ ಮೇಡಮ್. ಎಷ್ಟು ದಿವಸ?
Recording in progress.
7. Okay. Good. How about Ashwini? 3 to 5 years. Okay. He is on the ulnar now. Sir, illi kuda nodti, but they don't have idea. First I ask them to see the pulse diagnosis, then they place it on the ulnar now. So this is in fact is wrong method. So once place it on the directly on the right side by using the right hand itself, that is the wrong procedure. So in that way, whenever the patient comes to you, or that's the reason I ask you to sit in the my opposite direction. Otherwise, if the person is next to me he is standing, then I can analyze in this way. I turn myself towards him. Then otherwise, if this position, then I analyze in this way. So however, the opposite hand should be good to analyze the patient. If only you are touching to the, sir, what are the difference between these two? Once I place it in this way, then you are easily accessing that radial artery. When I am doing like this, then certainly I am touching to the radial artery and also touching to the palmaris longest tendon as well. If I touches to the tendon it get changes, because this pulse you cannot execute, but this pulse you may get it. That means that is a wrong pulse. You may get the pulse. Here I am not getting the pulse. In this way I am not getting the pulse. If I place it like this, I may get the pulse. That is in fact is the wrong pulse. That to be known as as per my perception, that to be known as a tendon pulse. Then you cannot be taken as the account that artery is deficiency or the organ is deficiency. So therefore left to left hand, then right to left hand, and then the patient's left hand and the practitioner's right hand to be used. Sir, yatra sir nododu first time bandre left hand takondu nodidre chanagirutta. This is not good. Always if somebody is offering, so please you just take it. So both the hands you are giving, that is one way is good. We are giving in the right hand, that is a pleasantable. When the patient comes to me, for example, now I wanted to analyze him. Oh, sir told that you are thinking that I should see on the left hand, then you are placing in this way and you are analyzing this is the way. But in fact this is totally wrong. Totally wrong, because there are the two major mistakes to be taken place. One mistake to be known as the position is not good, because you need to be get the alignment of the hand in the smoother way, right? Is either it is the too stiff or it is the too strong, right, or the too loose. So we have to be gently keep the hand and then try to analyze. If do like this and seeing the pulse is the wrong postures. We have to place it like this straight way and then place the fingers, that would be better, right? So either 3 fingers or the 1 finger, that would be. And you are seeing like this. First impression itself is a very bad impression. Yenappa itara idkoniddare. This is the good to analyze. This is the wrong. You place it support. We drink water also. We drink water. But like this we drink water, this is wrong. So we have to place it something, at least we should drink, give the respect to water as well. So in this way, so we have seen you take the support and then do it, take the other hand support and then do it. Now for example, pulse I analyzed, yes exactly this is the deficiency. Then what is the formula for the treatment? That formula I'll try to show you in the board. That would be easily understandable, that you just wait for some more time so that you can understand.
Question here. Sir, you mentioned that sometimes we may not feel the pulse or we feel it very less.
Yes.
So it can be the practitioners, like the way practitioner feels also, that can be a problem, or it is generally the pulse is less. Like what does it indicate?
You mean to say if the pulse is couldn't see properly or couldn't find out the pulse, there is the problem of the practitioner or the problem of the patient?
Like most of us will be new.
Yes,
So
sir.
how can we arrive to that it may be my problem?
Yeah, the question is how to understand in the better way to recognize the pulse. That is the which we need to understand. But however, once we place the hand precisely, only you need to touch, feather touch. Place it. If you can find the pulse, you just recognize. Otherwise, you don't recognize. That is the deficiency. You keep it in the mind, right? So, in the superficial level, when you understand, yes, it is the partially is there, that means the 50% chi is existing, 50% chi is deficiency on that particular organ. If there is the abundant of the chi, excessive, the pulse beats are hammering like this, then you understand there is an excessive of the pulse, and then that indicating that pulse or that organ is dominating nature, so that to be depleted. In that way we understand. But still we are in dilemma. So how we need to understand to the deeper level? In fact, it's not the super simple. Professor says that. So the pulse diagnosis is super simple, but it takes decades together to become the expert. In that case, your duty to analyze the patient, the whoever comes to you or at home for the children and everybody, when we try to understand and then cross check with them whether do you have the problem, something like that, so that we easily learn the concept and also try to study further deeper knowledge about the pulse diagnosis, because I cannot execute this is a second class to all of you. That's the reason in the short way I'm giving you the information. Who asked the question right now?
Kamal.
Sorry?
Sir, Kamal.
Kamal ji. So
Kamal
yeah, Kamal Anand ji, you and actually I have done the demonstration to you as well in the before class. I think cross check, because totally there are the 8 to 10 videos are existing in the YouTube channel related to only pulse diagnosis. You will get the immense knowledge about that, practical and then theoretical as well. That's the reason, please, this is just as a introduction of the diagnosis, but please go through that. You will gain the knowledge. Keep doing the same for the ever, then you will learn. But still I am also learning this, because it never ends. As I told you, star comes in 250 years once on the sky. So to find out that which star is coming up 250 years once, so we may live, may not live, or we may see, we may not see also. In that way, so some pulses are very, very critical pulses. In the whole career of the life, we may not see one type of the pulse. Also possible. In this way, that's the reason I told you, whichever it is possible, of course, which is the excessiveness or deficiency, we'll keep it in the mind, and based on that we will proceed. The second, if the pulse we couldn't see at all, then what to be done? So I'll give you the formula for that. So you need to implement that, and certainly you can reverse the pulse whatever existing or what is may not be existing. If the fu viscera is deficiency, in pulses are normal. If all the yang pulses are having the deficiency, that time what to be done? Already I told in the beginning classes. Yes. Very good. 0 point to be activated. If all the yang pulses are weak, then which point to be activated?
0.
Apart from that, Chungwan, that is the Ren 12 point. Ren 12 at the center of the abdominal region on the Ren 12 point to be activated. Then you try to find out the yang pulses will execute slowly. That energy is the acquired energy, artificial energy, synthetic energy, Ku energy, food energy, nutritive energy is the deficiency which leads to that problem number 2. Number 3 problem to be known as of course is the disease categories I told you, exo and then endogenous diseases. But endogenous diseases called as in-house diseases, or the home diseases, or the mental diseases, or the emotions diseases, or deep insighted emotions which reflecting the problem which is connected to the kidneys as well. Of course, these are the few parameters which leads to that problem. Even for the overuse of the body, that time the bones density, BMI, and also the density level get changes, that also leads to the problem connected to the kidneys as well. Then cross check all these parameters, one or other parameters definitely reflect that problem is connected to that particular issue. So therefore, what to be done now? Of course, is it possible to strengthen the kidneys and revive the kidneys to the normal level? Of course, most of the time, each and every person who is coming for the treatment related to the cervical spondylosis, lumbar and then knee osteoarthritis, or the bone related problem, or the marrow related problem, or the muscle related problem, certainly think about that kidney chi having the deficiency which leads to the problem. When there is any spur is there, or the calcaneal spur is there, or the excessive function of the kidney also leads to the overgrowth of the bones, which leads to the kidney hyperactivity, which causing the problem. In that way we understand. Of course, then what is the prime solution to do that? But generally I would like to give you as that there are the majorly few points that's called as the Fulio Tai Chi Ingu. There are the 3 points to be activated. One point is the K10, the second point is K7, third point is the K3. Of course, these are the 3 major points would be advisable to strengthen the kidney system. Strengthen the kidney system. There is a power off here, and within short period it closes, and again we reconnect him. In that way the bladder also having the deficiency. Then what are the points to be activated? Always keep it in the mind. There are the 2 points, 3 points for the tonification and 2 points for the sedation of the each organ. One point to be known as a mother point, second point to be known as a grandmother point. You just activate these 2 points to strengthen to that particular organ. For example, K7 is the mother point and K3 is the grandmother point. Activate both the points to strengthen the renal system.
Recording in progress.
Now I am audible in the Zoom?
Yes, sir.
That's
Yes,
great.
sir.
That's great.
Wow.
Awesome. So hopefully we understand now what is the protocol. Quickly I just proceed for the pulse diagnosis. There are so many pulses are existing, I believe. So which is the right time to diagnose the pulses? But is it possible in the night time, morning time, in the noon time, pre-lunch or the post-lunch, or pre-breakfast or the post-breakfast? Of course, 5 to 7, we keep it in the mind, 5 to 7 will be the ideal time. That means after the urination, after the bowel evacuation, once the purgation to be taken place, later it is advisable to see the pulse diagnosis in the morning time. So whenever we go to the centers, so that time when the patient comes to us, for example, my timings I can say, that time only I can understand. If the person is very much, he had the breakfast, he required the 2 idlis or 3 idlis, perhaps he took is the very delicious is the 4 idlis and 2 vadas, and then again he took as the masala dosa or something like that, because he came first time to Bangalore to have something is the good amount of the food. Then he is coming for the diagnostic purpose. When the stomach get pop up in the rapid level, then you understand he had the full of his stomach of the food. So that's the reason it's showing that. But you cannot taken as accountable that yes, of course this is the problem. You cannot take it as account. The second, when the person goes to the one ceremony to be known as a marriage or some kind of the condition where the most of the delicious were there, the biryani he took is the one biryani normally take in the restaurant, the person took 2 biryanis, and also he took as a maximum delicious food. That means the greasy food who takes more. So that time the gallbladder energy get excessiveness, that cannot be taken as a account, he have the more problem. When the person is coming in the empty stomach, that time, so of course the stomach chi get deficiency. You cannot be take it as a problem, is the stomach having the problem, because he didn't have the breakfast or lunch or dinner, so on. When after the evacuation of the intestine, so the whole intestine is empty, but that time you cannot take it as a account that he have the problem is in the colon, because just he eliminated or passed the stool. When the person comes to you, just he visited the restroom and he just paused his urination, he is coming immediately next to you, then you are seeing the UB pulse is deficiency. Cannot be taken exactly this UB is deficiency. Sir, ಮತ್ತೆ ಯಾವ ಥರ ಸರ್ ಅರ್ಥ ಮಾಡ್ಕೊಳೋದು? But of course, all these things are required to understand. Slow and steady, you feel that you will get the idea about it. You just check with them, touch the bladder, palpate that, yes, if the bladder is empty, but of course you don't have any problem related to the bladder, then you understand, yes, your bladder is good only. If you don't have any manifestation of the sign and symptom,